Hi, this is John Zimmerman from Holon Solutions, and I'm joined here today by Robert Connolly, who's our Chief Product and Strategy Officer. Please say hello, Rob.
Thanks, John. Hi, everyone.
Hey, we're going to walk through what Holon does for SDoH. We're going to walk you through the story about how we applied SDoH in a connected network to improve outcomes across Michigan. So where did you get your start?
Great question. So there was a catalyst event that really kicked this off. In Flint, as many of us are all well aware, there was this lead crisis that related to the different levels of lead in and around the community that made national headlines and news. And so what we found was that if we could begin there at the ground zero of that crisis to start helping those community members of the community, as well as the service centers, start to track and better manage the flow of patients, both in the healthcare continuum across over to the social service centers, we would start making a more exponential impact in that very small, focused community setting. And then from there, we could ideally bridge that or expand it further into the greater portions of the state, taking the same model, reproducing it over and over again with the great impact that we were trying to make.
So when I look back at one of the other pictures, it seems like you actually built and placed a coordinating bridge between the workflows of both the people in care delivery practice on the medical side and the social services, and they could essentially collaborate on a system that brought both of their workflows together in context. Did I get that right?
You got it. That's exactly right.
So having done that, having seen that, were you able to measure any kind of an impact?
Yes. The first thing we started to look at was, okay, now that we have hundreds of organizations on the network and thousands of different providers and users using the tool daily, what are the number of days to complete, let's say, over time? Are they getting better? Are there resource gaps in the community? So this presentation, or this slide here, presents average days to a specific type of status over time as an example. So when you send a referral out to some party on the other side, there are certain numbers of days, depending on the specialty, that it takes to accept that referral, or perhaps get that patient scheduled in for an appointment. And if the patient didn't show up, did they get rescheduled, or was the appointment ever completed by either the social service setting or the clinical caregiver setting? And providing that visibility and transparency across the network enables folks to really understand where the greatest amount of attention might need to be paid for certain areas of the community specifically. Moreover, what we started to look at was the rise of adoption and adherence to different care plans and programs as well throughout the community. So as we started to look at the different specialties that were participating in the clinical setting with those from the quote-unquote non-clinical, more social setting, we could see a rise of collaboration between those parties. And then we could start to drill in on, okay, is this making a true impact by virtue of having that community linkage? Because these parties are now more and more connected, and the patient flow is much more transparent through the system itself.
It sounds like what you're saying is SDoH is not an island unto itself, nor is medical care an island unto itself, but it's that informed collaboration between the parties that make a big impact, or can make a big impact. Is that a fair thing to say?
Exactly. They really are the same in a way. They're, if you're not working in both settings collectively, you're really not helping the community entirely.
Well, Rob, thank you very much. That was quite a journey, and took quite a long time, I think, to get that journey done. But you've planted something that really is making a difference in a number of communities, actually, in Michigan. And thank you for sharing your insights with us today.
Absolutely, it was my pleasure.